Hey there, wanted to welcome you to another edition of the Next Gen podcast, where we're doing everything we can to help educate you on how to provide a better benefits experience for your employees. And the great news is that with today's day and age, we have more and more resources to really take back control of healthcare and to deliver that better experience that you've been craving for your employees and that, quite frankly, your employees want. So, today's edition, we're going to have Chris Corkran with Creative Benefit Consultants on with us today. Creative Benefits Consultants is based out of Kansas, and they are doing some really great things. Chris has been a mastermind in putting together several different avenues that work really, really well for that small to mid-sized group space that I happen to love a lot. So with that being said, really excited about this conversation. Chris, thanks for coming on today, and just want to hear a little bit about who is Chris Corkran. What gets you up every day?
Yeah, absolutely. And I appreciate it, Nick, a lot. The small groups that's our passion. We've been playing in that space for as long as I've been in the business, which was back in 2006 is when I got into the health insurance business. And ever since then, it's been in the small group market, primarily in that under 100 space. And, over the last probably five years or so, just really seeing all of the new concepts that are coming out with, the Health Rosetta model and the next gen masterminds and, those different types of concepts that are being pushed on the bigger group side. I thought, man, it could be really cool to do something like that, but for the smaller group market as well, because not only are they feeling the pain, probably more than anybody, but it's the largest group segment in the entire country of businesses. So that's where we play. That's our passion, and it's been really exciting being able to build these programs and take these programs out to advisors coast to coast and the groups and prospects that they're working with.
Absolutely. And Chris, one of the things you had mentioned was, Health Rosetta style plans or next gen mastermind or mastermind. I talk a lot about Health Rosetta because I'm involved there, but the audience is probably tired of hearing me talk about those type of plans. Explain a little bit about what those plans are and how they're different from, what maybe a traditional small group is experiencing with their, big Blue Cross Blue Shield, United Healthcare type plans.
Yeah, the cool thing that I always think about when I think of Health Rosetta, it's an ecosystem, right? Of, how do we do this correctly? But I really do believe that, it's really about taking care of the members at its core, right? And, we try to do a lot inside of our plans to enhance benefits for the members. And I think a lot of people say that they want to enhance the benefits, but, how many people are really going and saying, I want you as the member to get the very highest quality of care possible whenever you have to access the healthcare system? Not many, I think. And I think that's at its core. I think that's what these plans are really built around is how do we take care of the member, medically, clinically, financially, and really make sure that, they're getting the very best quality of care, at the very best price possible, which is going to help them out. But in whole, it's going to help our plans out and run more effectively. So we're all about transparency. We're all about, making sure that we're getting the highest quality of care possible. We do a lot inside of our plans to guide to those providers. We do a lot in regards to zeroing out members' deductibles whenever they follow that guidance. So it's just all about being able to bring something unique to that small group space that they just typically haven't been able to access before.
No, that's a really great point, Chris. And one of the things I like to share with people is that, navigating the healthcare system was not taught in school. It's not something that people are inherently know how to do. So can you walk into when we're doing plans that like what we're going to get into with the plans that you've built, explain how that really creates kind of a VIP concierge feel for the employees and how, kind of from your experience, how have employees been receptive to this?
Yeah, and as we were building these plans a few years ago, I reached out to quite a few people that I trust in this industry and got their opinions on what's going to make these plans the most successful. And the number one response that I got back was having a proper education concierge hand-holding entity that's going to help these members walk through probably the two most cumbersome systems in America, and that's the healthcare system and the health insurance system. So being able to bring those pieces into this plan, and we're continuing to enhance those pieces even now, but being able to have medical management that can come alongside of the plan with nurses and doctors that can really come in and show that they care, and help these members get to that right quality provider for the services that they need. Having a benefits concierge team that is dedicated solely towards that particular group. What 15 life group out there has that, right? I mean, yeah, 500 life group might have it, but those tiny groups don't have a phone number to where they can just pick it up, anytime and say, hey, I don't understand this EOB that I got from my insurance. Can you help walk me through this? Or, hey, I really need, to go see a new doctor for a condition I was just potentially diagnosed with. Can you help me find the best one possible for it? And we can unequivocally show them this doctor is a really, really good doctor for this particular condition. Or don't go to this doctor because, there's going to be a lot of complications potentially. And people don't have that. They're starting to get that in the bigger group space, but they don't have that in the small group space. And that was really kind of our, onus on why do we do this? Why do we build these plans the way that we do? And that's to allow these members to properly use these two very difficult systems that we have.
No, absolutely. And, the extreme example is, if you go get into surgery somewhere and you contract a staph infection, that became an expensive day and turned into a really expensive day. Kind of one last thing to kind of help people wrap their minds around how we're driving down the cost of benefits. The example I'm going to give to you, Chris, is when we're going and purchasing surgeries. Mm-hmm. You talk about quality and you talk about cost. Can you walk us through how not everywhere that you can get an ACL repair is the same, and how when we're focusing on quality, we're focusing on cost, how that brings stability to this small group market?
Yeah, absolutely. It's interesting because, generally in our world, we think the best quality stuff is the most expensive stuff, right? Cars, TVs, houses, the higher up the quality scale, the more expensive it is. It's actually the inverse from what we've seen in the healthcare space, because the highest quality doctors are the ones that do those procedures all the time, and they've perfected it and they're experts in that field. And so their complication rates are very low. Their readmissions are lower. Their mortality rates are lower. Their infection rates are lower. And because of that, they're able to charge a better price for the services that they're doing, because they don't have all of this other extra stuff that's going on behind the scenes of having to, re-see patients multiple times because they couldn't figure out the issue or operate correctly or whatever it is. So going to the highest quality provider is, I would say, 8.5 to 9 times out of 10 going to yield better pricing, if not for that one individual claim, certainly over the life of the claim, because you're not going to have to go back for multiple procedures, multiple visits, multiple, times to go treat an infection like a staph infection or anything like that, because you're going to the expert in that particular field. And if we can get you to the very best doctor possible for that ACL surgery, who, in my opinion, who in their right mind would say, no, I don't want to go to the best doctor. I just want to go to this guy down the street, or somebody that my neighbor had their 3 ACLs repaired from. It's like, we can show you the data. You can still make the decision on what you want to do, but we can show you the data and say, if you go here, it's going to yield the best results and it's going to be free for you. Most of the time they follow that guidance.
No, absolutely. And that's you use the 4-letter F word that I really like, which is free. And that's the whole goal, is that when we're able to better educate, and Chris's plans that he has built, and that we're utilizing, they're designed to get your employees free care. And all it is, the only thing they have to do is be willing to become a better consumer. And we've built everything, or Chris rather has built everything into these plans to make it really easy. It's an easy lift for you as an employer or a plan sponsor. It's easier for your employees. They just have to be willing to do it. So, Chris, let's start with your employee business alliance plan. This is an association health plan. Let's start with what is the details of this particular plan, and then we'll start digging down into more of the nitty gritty of it.
Yeah, for sure. So really what we've done, knowing in this small group space that not every group is a one size fits all, right? And we started down this path with our most aggressive plan designs and our most aggressive steerage, and it worked great. But people sometimes weren't ready to jump from a fully insured plan straight to this let's pull every single lever that's out there type of program. So really what we've done is we've built a strategy that we call crawl, walk, run, fly, that allows a group to look at multiple different options within the spectrum of where do I want to be today, what can I afford today, but allows you as the consultant and the other advisors around the country to say, great, you're here today, but here's where I think that we can get over the next 5 years. And here's the steps that we're going to take to get you there. Having that plan in place to where it's not just a transactional every single year, I got to shop this and move it from Blue Cross to United to Aetna and back again. Let's come up with a long-term strategy to where we can actually invest in our program and have it yield returns back to us as a group. So the association plan that we've put together is our crawl version inside of that spectrum, and it works really well for the small group space. Primarily groups under 50 is really where it goes down to, and we can even go down to groups of 1 on that program, which you run across a lot of solopreneurs and a lot of mom and pop shops, and we do a lot of family farms around the country to where these small groups are struggling and they don't have an option. So with this association plan, we're able to kind of bring them all together and purchase stop loss as one large entity underneath this structure and umbrella, to where now we're able to bring these great group benefits downstream to these smaller groups. With this program, I would say it's as close to a fully insured type of structure as we have. It's not pulling a lot of levers in regards to cost containment. It's really that let's get you into the self-funded world. Let's get you used to working with independent partners on the TPA and PBM side and that sort of thing. Let's get you comfortable with it, but then let's move you down the spectrum as you get more and more comfortable with it. But it works really, really well for those tiny, smaller groups.
Absolutely. And would this be a fair statement, Chris? When we're talking about the big carriers, fully insured, Blue Cross, United Healthcare, Cigna, Aetna, there's a circle, and they've got their pharmacy benefit manager and their administration and their stop loss. That's all built in the circle. And so you're already currently buying a plan that has these things. What you have done is you've just went out and you found the best partners in each of those categories. So we're going to have the best pharmacy benefit manager, for these type of groups. We're going to have the best administration. And so it's not that undifferent from a fully insured plan. It's just we're going out and sourcing, what we believe to be the best in the industry.
Yeah, they're all, I kind of consider them rebundled, unbundled health plans, right? Because right now the carriers have everything, sewn up, right? They're doing the administration, they're doing the pharmacy side of things, they're doing everything, right? Customer service, claims, pre-certs. So they control the whole kit and caboodle, which means that either A, you have zero flexibility, or, they can, take money from this side to move it to this side and still come out ahead. What we're doing is we're unbundling that, bringing in our own, third-party administrator that's going to be the best option for those groups, bringing in the pharmacy benefit manager that's going to be the best option for those groups, medical management, prescription concierge services, networks, reference-based pricing, whatever. And we're repackaging it back together to make it really smooth and simple to where everybody knows the players involved. The communication works very well behind the scenes between all the different vendor partners. And that's really kind of our main job, is to be that hub of the center of the wheel to make sure that all of these different components are working and communicating the way that they need to, because we aren't underneath one big umbrella like a Blue Cross plan might be. So that's probably 75% of our job is just making sure that all of this stuff is working the way that it's supposed to work, and the communication happens the way that it's supposed to happen. So where if we're running across a specialty medication and we're wanting to make sure that we're getting it for the best price possible, the PBM and the medical management are communicating with the specialty carve out service, and then we can go out and get that program in place for that particular medication. And now we just saved the member and the plan significant thousands of dollars on that medication. So it's all about how it's intertwined and how it works behind the scenes is kind of the fun part on our side. But it is a little bit different, no lie, from a fully insured type of structure. But having the concierge in place to where you do have that one number, one phone number, one email address, one website that you can go to, it really does help simplify that significantly.
Absolutely. And, people think that they're fully insured. And so, it doesn't really matter what happens as far as claims go with inside their group, but it absolutely does. I mean, yes, it's a collective group. It might be all the employees in the state of Kansas or the state of Nebraska. They are a part of a big Blue Cross plan, but the more and more claims, the more and more they raise rates. So one of the things that I love about your plan is that we are using the law of large numbers. We're bringing specifically on the plan we're talking about right now, the association plan, we're bringing a lot of employees under one umbrella to help spread that risk. One of the biggest struggles for small groups, those groups under 50 and definitely under 20, is stability. They try out the quote unquote level funded type plans or self-funded plans, and they do. Can you speak a little bit to how the association helps to bring some stability and predictability to increases each and every year?
Yeah, absolutely. So, in this program, outside of what's being done in the fully insured market, they have to take all comers, right? So there's no medical underwriting, and you could be on your deathbed and they'd still have to take you, right? With our programs, we're still going through underwriting, so we're able to keep that pool, if you will, fairly clean. But then we're also doing some stuff behind the scenes inside of the stop loss, inside of the prescription program, to make sure that we can mitigate those situations as they come up. We have multiple direct contracts around the country. We work with reputable reference-based pricing programs. If groups want to go down that path to where we are fairly competitive and getting the best rates whenever people do need to use their healthcare. And then we use like a Cigna type of network in place for the people that want to go on a PPO type of structure. So we're doing a lot behind the scenes inside of that program to use that, law of large numbers to be able to, contain the stop loss premiums a little bit more effectively, but then also be able to spread that risk out over, thousands of groups instead of just your little 2-life group, 5-life group, 20-life group that might be wanting to look on their own. So the medical underwriting is the biggest component up front, but then on the backside, still having some of those cost containment levers being pulled as needed really helps to maintain the integrity of that pool.
Absolutely. One of the only real big downsides I see to this is that you do have to collect medical forms on every employee. And I know that some people, they struggle a little bit with that. I'm here to tell you, I'm a huge advocate of it because it lets us truly assess what's going on inside your group. If you're a group that really needs to be fully insured, we're going to tell you that. And there's a reason for it. You may have some excessive claims, but it also allows us to price it right. When we look at your group and we say, wow, there's really nothing going on, we can be really aggressive on this pricing. It can save you as an employer a ton of money. So Chris, wrapping up on the association health plans, best fit is going to be groups under 50. You do go down to one life. So if you're out there with a small business, a couple of employees, you want to offer a plan, this is a great option. If you're a solopreneur, again, a great option. Really, the only reason not to look at it is just that you're not ready for it. In my opinion, when we're talking about these plans, I mean, they're such a great solution, Chris. Like I'm so thankful to have this out there for these small groups. It gives them an option that isn't Blue Cross Blue Shield, these big fully insured expensive plans. So moving on to your gateway plans, Chris, this is kind of the next step in your crawl, walk, run, fly approach. Let's get into gateway. Talk a little bit about what's different about these particular plans and start digging into those.
Yeah, so the first big difference is they are individual standalone groups contracts. So whereas the association plan, we're kind of pulling everybody together. In this program, it's a little bit more traditional. We're going out and procuring stop loss for each individual group independently. But really, the reason why we called this the Gateway Plan is it's really your entry level into standalone self-funding. We can start it, as a level funded type of structure, making sure that we levelize that premium out throughout the year. But really, we're starting to get into prescription medication management more aggressively, to where we're sourcing brand names and specialty medications internationally. You're trying to access whatever assistance programs are available for those medications, to make sure that we're eliminating or mitigating those costs for those meds whenever possible. We're starting to do a little bit more in regards to the medical management side of things, making sure that members are going to the right place at the right time and at the right price for the services that they need. We're doing standard network type of plans with like a Cigna or an Aetna type of network, or a regional network, if that makes more sense. Or we can do reference-based pricing on the structure. So even inside of the gateway plans or the association plans or the catalyst plans, whatever, we have multiple different paths that you can take, to get where you want to go. So if a group wants to, they're leaving a fully insured carrier for the first time, they're wanting to get into this self-funded world, I would probably look at doing a gateway plan with a Cigna network, and just kind of getting them used to the players, used to the feel of how this works. And then as we have success year over year, we can start pulling the additional levers. An example, we were working with about 100 life group in Tennessee, and last year we wrote them on the gateway plan using the Cigna network. They had a decent year. They had one big claim that came up that nobody could have predicted for, and we got that person taken care of. But this year at renewal, they were ready to go further down the path. So we kept them with Gateway, but we moved to a reference-based pricing program with ClaimDoc. And so now, they're able to go and save. It was about a 25% savings on their cost to go into that next step. And because we're able to do a little bit more on the medical management side of things, when you're outside of the Cigna network world, we're expecting their cost to go from about a $10,000 per employee per year claims cost down to about a $6,500 per employee per year claims cost. So whereas they could have sustained the Cigna network budget wise, it's going to make significantly more sense for them to move down that path, take a little bit more aggressive approach, and be able to control their costs significantly more effectively.
No, absolutely. And really, one of the things I want to explain for people is every other piece of your business, the exact cost of what you're buying and everything else. And so when we're talking about reference-based pricing, what we're doing is we're using whatever Medicare reimburses at. We're using that as our reference for what we should be paying for services. So traditionally, that's somewhere between 130 and 170% of what Medicare reimburses is what our contracts will reimburse. Conversely, if you're looking at a big network, a lot of times those are 250, 300, sometimes upwards to 500% of Medicare rates. And so it just allows us to help bring down those costs. And that's kind of where you're getting some of that 25% savings, is that we are just paying a fairer price for every procedure. We won't get into the full nitty gritty of that. When somebody jumps into the gateway plans, one of the things that you talked about was pharmacy and everything there. Let's talk about pharmacy for a minute. How you guys are helping people get the medications that they need more cost effectively, but doing so while saving the plan significant dollars.
Yeah, so that's a great point because pharmacy is not only is it a huge piece today, but it's becoming a bigger and bigger piece as more and more drugs are coming out that are really expensive medications. So, you're going to start seeing more and more gene therapy drugs that cost $3 million a year that are going to come out. And, having a plan for how you're going to attack those medications and have a valid strategy for it's going to become a huge over the next probably 3 years, particularly as more and more of those medications come out. So, really, what we're doing, the first thing that we do is we work with an independent, transparent pharmacy benefit manager, meaning that they are properly aligned in their incentives inside the plan to make sure that we are getting the lowest net cost possible for the drugs that we're having run through the plan. So there's no incentive for them to put a higher cost drug on the formulary because they're passing through all of the rebates that are coming through directly back to the group. So whereas in a fully insured market, and it's kind of interesting that most of the fully insured carriers are owned by pharmacy, on the pharmacy side of things. So, they have an incentive to have a higher cost medication be filled underneath the plan because they're going to get the rebate and they're going to keep the rebate. So it doesn't make any sense for them to put a biosimilar or something cheaper or direct to an alternative medication or anything like that because they want to fill as many Humiras as possible on their plans because they're going to get a big fat refund check that they're just going to pocket. And then at the end of the year, the employer pays $60,000 a pop on those Humiras, and now they're going to get a higher than average renewal. They can't go out and get another level funded plan because now their claims don't look so good. And it's all because these medications are flowing through the plan that don't necessarily have to. So by using an independent PBM and kind of getting rid of that rebate game, and just trying to get the lowest net cost possible for the drugs that are out there, we're able to save some substantial amounts of money for the members on the medications that they need. But then we're also able to have the flexibility to partner our PBM with a company like a Script Sourcing or an Optimed or one of those companies out there that are able to look and find the same medication internationally that's available domestically, or tap into an assistance program that might be available for that particular medication. And when members follow that path, they can now get those medications that are costing them hundreds, if not thousands of dollars a month down to zero for them. And whenever that happens, the member wins. But if we're able to eliminate the cost through an assistance program or whatever, the employer wins on their claim side of things. But even if we can't and they source it internationally, we're still able to get it at 50, 60, 70% off, the retail domestic cost for those medications. So, once again, this is just an education piece of the program is like, why would I not just go down to Walgreens and pick up my medication? Well, you can, but if you do it this way, not only is it going to be free for you, but it's going to save the plan substantial amounts of money, which means you're not going to have to jump carriers every single year back and forth. So, just working with the right partners is the biggest piece of that puzzle, I think.
No, absolutely. Well, we're jumping over now to the Catalyst plans, and I have to tell you, this is where I get really excited. I've got it pulled up right here. This is going to look a little bit different than what a lot of people have seen before. A lot of people are used to a two-tiered type plan. Catalyst plans are a 3-tier, and the reason that I get excited is because tier 1 is the area where I see zeros, $0 deductible, $0 copays for just about everything. Chris, is that having your cake and eating it too?
Yeah, they're my favorite plans, and it's the plan that we created first and foremost because it's the one I wholeheartedly believe in. And if a group gets it, an advisor gets it, it's the one that's going to yield the best success over the long run, not only financially for the members, but for the group as well. Because, once again, what we're really doing, as you mentioned, most plans out there have a 2-tiered structure where you have your in-network benefits and you have your out-of-network benefits. And if you go and stay in network, you're going to have your $2,000 deductible, copays for doctor's visits, all that kind of stuff. You go outside of the predefined network that the carrier has, and you're going to double all that up, right? And so you're kind of stuck in that box that the carrier puts you in. That these are the providers that you can go to. This is what's going to cost you, and then the plan has to pick up the rest, right? So really what we're doing on this program is we're adding a tier 1 benefit to where you can still have your in-network level of benefits with your $2,000 deductible and copays and all that kind of stuff. If you don't want to do anything different than what you're doing today, okay, that's up to you. You can have your out-of-network benefits if you're using a network plan with a tier 3, if you will. But really what we're doing is we're trying to really push hardcore to members using that tier 1 level of benefit. And that tier 1 level of benefit is going to be ones that are the very highest quality provider for that particular need or service that you have, a provider that we have a negotiated direct contract with, a direct primary care type of provider. Any of those providers that we have for a particular group or relationship or whatever would fall into that tier 1 category. And essentially what that tier 1 category will allow you to do, it will allow you to get the vast majority of the services that you need done at $0 out of the member's pocket. And the reason why we're able to do that is because we're able to save such substantial amounts of money on the claim that why wouldn't the employer just say, yeah, we'll pick up your deductible, in that situation, right? So take like a hip replacement. I was looking at one, I think in Wichita, Kansas, a couple months ago, and the price discrepancy for a hip replacement on the low end was like $17,000. On the high end, it was about $55,000. You as the member, you as the employer, have zero idea what that cost is before you go in for that service. And in today's model, you really have very little idea on if that doctor's any good at performing hip replacements, right? So if you go in just because you got referred by your doctor or your mom had a hip replacement at this place, so you got to go there as well. So there's really, and they're starting to get better, right? With the CAA and the transparency laws and that sort of thing. You're starting to see a little bit better information that's out there, but still it's not as granular as what we can access through our medical management partner. So being able to go and say, all right, let's go to the very best doctor that's ranked in the 99th percentile for hip replacements, and it's going to cost the plan $20,000 versus the $55,000 that they could have paid if they went to this provider. Yeah, we'll just pick up that extra $2,000 deductible, and you get it for free because you made a smart healthcare decision. It's kind of the same. I always think about it as like it was really kind of the intent of the high deductible health plans and HSAs, like making people better consumers, right? But they had skin in the game, whenever they had an HSA because they had to pay up to their deductible, right? This is kind of the inverse of that, right? Because if they make the smart healthcare decision, instead of making them pay out of their pocket, it's now free for them. And what's better than free, especially when it's for the highest quality doctor that's possible for that, for that procedure or treatment or anything like that.
In working for big companies in the past, one of the things that they required you to do is they had, a certain hotel chain or a certain gas chain that they required you to go shop at. And why? Is because they got a better deal. And really what your plans do, Chris, is they give that to employers. You're buying a Shell card or a Hilton card by purchasing a plan or a program with CBC, and we are giving your employees the instructions on how to use it. So again, it kind of goes back to we look at every other expense in our business. This has been the one that has been so hard for business owners, especially small business owners, to tackle. And I'm excited that we finally have this. My mission is to eradicate medical debt and poverty in the United States. When we give people the opportunity to go get costs for no money out of pocket, we are helping to solve that problem. That's medical debt that our people don't have to have. And I serve blue collar, rural America. I just get super excited about it. So Chris, trying to kind of wrap up this conversation today. I'm an employer. I've been with Blue Cross Blue Shield for the last decade. I'm tired of the increases going up 13% every year. I think I've got a pretty healthy group, and I've got 20 employees. Does it make sense to maybe start out this year in the association health plan? Maybe I'll do that for a couple of years. Really assuming that I'm an employer that wants to, be proactive, but I don't want to create too much change at once. Going from the association or, coming out of fully insured into the association health plan, getting all the way to a catalyst, what does a good time horizon look like? What is a good expectation people can have?
Yeah, I really do think it's going to vary on the group, because I've got a lot of groups out there, and really the advisor too. I've got a lot of groups out there that have gone straight from fully insured to catalyst with reference-based pricing and pulling every single lever out there. And they love it because they were properly educated prior to going into it. And the C-suite was on board, the HR was on board, and they said, this is what we're going to do, this is why we're doing it, and this is how it's going to benefit you. But we've had a ton of groups that have come in and said, we're not ready for that yet. Like, we want to take this slowly. We want to get used to getting outside of the BUCA world, if you will, and they'll go into the association plan, or even the gateway plans with a full network, and just kind of get their feet wet and understand there's a different way to do this. And that's why on a lot of our marketing pieces and different things like that, we talk about member noise. And really, the further down the spectrum that you go, the higher the potential for noise is for the members, especially if they're not properly educated. Their hands aren't being held by the concierge or by HR or whomever to let them know, hey, this is really for your benefit. We're not just trying to race to the lowest, cheapest plan that we have, or the worst doctor possible that's going to charge us the least amount of money possible. It's the exact opposite. We want the very, very best for these members in order to make sure that the employer gets the very, very best outcomes for their plan as possible. So, some groups, it might be right away. Some groups might take 5 years to move down the path. Some groups might never move away from, the association plan or the gateway plan with the full network, because they are comfortable with it. But the path is there. It's built to allow you as an advisor to be able to say, all right, here's the path. Here's where I think we can go. What are your thoughts? What is your appetite for noise? What's your budget? Where do you want to take some of this money that we're going to save you and reinvest it back into your company? If we can get you a big dividend back from your health plan because we save so much money, are you willing to give premium holidays? Are you willing to boost up your employer contributions? And now you can become an employer of choice in that market, because not only are you offering $0 deductibles, but maybe you're paying 100% of the premium cost. So your employees truly have free healthcare and free health insurance whenever they need it. So, that's a pretty cool story to tell for these, smaller groups that, they've never been able to tell that story before.
And I am here to tell you, as soon as word gets out that you have $0 healthcare, you are going to see a couple of things happen. One, I truly believe that your employees that are currently working for you are going to see how hard you've worked to try to fix the system and try to deliver better for them. So I think you're going to see increased longevity. You're going to see better retention. But I also think you're going to, I talk to a lot of employers and they tell me, we're struggling to get applications. I think you're going to see more applications. I'm not going to promise that they're great applications, but I think that word's going to get out and people are going to see that you truly are, as you said, Chris, the employer of choice. So, Chris, I really want to thank you for coming on today. If you're listening to this or watching this and you're interested in getting a quote and seeing if, maybe CBC or a Catalyst or Gateway or Association Health Plan is the right fit for you, Chris, what do people need to do?
Yeah, absolutely. So ideally, you can reach out to Nick, get all the information over to him, and then we go out and we build everything on an individual group by group basis. So what we try to do is we try to put together the crawl, walk, run, fly approach on every single group that we do. and then allow you guys to make that decision of where do you fall today, what's your mindset today, but allow you to kind of plan for the future as well. So this isn't a 1-year fix, right? This is something that's, yeah, hopefully we can save you money the first year. That's the goal, obviously. But our goal is that we're going to save you a ton of money over the next 5 years. And that's kind of the cool thing. So I reach out to Nick and his team, and we'll start working with all the small groups and everything like that we run across, and hopefully be able to make a big difference in this market space.
Absolutely. Well, again, thank you all for tuning in to this episode of the Next Gen podcast. So thankful that I have Chris as a partner. Really like what he's doing. I know that he's doing a great job. His mind and heart are in the right place. He's a great fit for Next Gen Benefits, where we're just trying to change the landscape. We're trying to help you as business owners take back control of your benefits, help deliver benefits to your employees that they actually want and need. So with that being said, if you want to find out more, make sure you reach out to us. Until then, we'll see you next time.
Appreciate it, Nick. Thanks.